Hello everyone, it's your friendly neighborhood infectious disease guy Rajeev Fernando here with another update on the management of COVID-19. So let's talk about where we are in the country right now with COVID-19 infections. Europe has actually gone past the United States right now. Certain countries are in lockdown. France alone has more than 50,000 cases a day, complete national lockdown. So that's what we have there. Moving on to the United States, we have about 500,000 cases recorded in the last 7 days. But to put that in more perspective, every 110 seconds an American is dying from COVID-19. So that's where we are right now. I've been asked to talk by many of you about the current management of COVID-19. So that's what we're going to do. I'm going to divide this column into really two scenarios. The first scenario I'm going to do is the outpatient setting, and the second setting I'm going to do is the inpatient setting. Broadly, what is the definition of outpatient versus inpatient is supplemental oxygen. If you don't need extra oxygen, you don't need a nasal cannula, you don't need ventilation, you don't need any of that, you are staying outpatient. The minute you require the smallest dose of a nasal cannula, you are inpatient. So that's really the way to distinguish this. So let's talk about this over here, and we're going to talk about a drug called regeneron. Now, regeneron is a drug really which is what we call an antibody cocktail. So what really is regeneron? Regeneron is really like injecting a new immune system into the body, and this finds the COVID-19 virus, binds to it and takes it out, and that's why it's called neutralizing antibodies. The president used it last month. Great drug. I guarantee this will work, but it's going to be expensive. They haven't put out the price, but definitely a couple of $1,000s. And who's going to be able to afford this? That's another thing. Who gets this Regeneron? So I feel the reason people would get Regeneron is it prevents you from going to outpatient to the inpatient. And people with high risk factors, age, male sex, hypertension, diabetes, chronic medical problems, liver disease, renal disease, immune compromise, these are the patients who will benefit from Regeneron, so stay tuned to that. Now, let's move to the second section. Inpatient, like we discussed, supplemental oxygen, you are going to the hospital, all right? So the drugs that we're using over here is something called remdesivir, which has been used for months. It really becomes the first FDA-approved drug. Remember, it was used as EUA drug before, which is an emergency authorization, but now the FDA has actually made it standard of care. In my clinical experience, I think it has a very lukewarm response. I think what it does is it shortens the hospitalization stay a little bit, but no benefit on mortality. So that's what the WHO actually did a study last week, and they found no additional benefit, but completely approved in the States. Once again, $3,200 for a 5-day course. It's being used standard of care over here. My personal feel is I think this would work better in the outpatient setting. Remember that when someone's in the hospital really sick, it's the virus and the immune system fighting, which is called the cytokine storm. In the outpatient setting, it's really the virus that's starting to attack the body, and that's where I feel it would be more beneficial. But remember, we're following US guidelines, and remdesivir is the drug over here. Now, the Mac Daddy drug over here, which is going to decrease mortality, steroids. A couple of dollars to use steroids. They decrease mortality really well, and they are down to, they decrease mortality. If you're an ICU patient, it decreases mortality by 35%. If you're an inpatient hospitalized, it decreases mortality about 20%. So that's what I really want to know. We'll be talking more and more about the upcoming, why there are more infections coming up. But I also want to quickly point out a company that I've developed. It's called MaskUp Earth. It's maskupearth.org. And it's a self-funded project where we distribute masks all over the world, free of charge, of course, to people who need them. I realize people sometimes say, wear a mask, wear a mask, wear a mask, but a lot of people can't afford them or they don't have access to it. So we've distributed all over the United States and to about 27 countries so far. So if you or someone you know need a mask, please hit me up on maskupearth.org. We'll definitely send you the masks, and as a matter of fact, I'll pay for postage as well. So we will be back in about 48 hours with the next update on COVID-19. For now, see ya.